Okay, so we will start our session for today. Um, Good evening, all of you. I welcome all of you on behalf of Target MRCPCH Academy for this interesting feedback session. It's always nice to hear the experiences of our candidates who have passed out in flying colors. It's an opportunity actually to learn from them their experiences, how they prepared. So it helps a lot in our preparation. These small things helps a lot. So today we have candidates Dr. Hari Tyagarajan. Good evening, Pa.
Hi, sir. Good evening, sir. How are you,
Oh,
sir?
fine. Okay.
Sir,
Yeah. Dr. Shajita.
Good evening, sir.
Good evening, Pa. How are you, Pa?
I'm fine, sir. How are you, sir?
Fine, Pa. Fine. And Dr. Sasi Rekha.
Yes, sir. Hi, sir.
Good evening, Ma. Good
Good
evening.
evening, sir.
So first of all, before moving on, congratulations, Ma. Congratulations to all three of you for
thank you, sir. Thank you so much.
out in flying colors. Uh,
Thank you, sir.
but it
We
doesn't
know,
come
sir.
easy actually. The hard work you have put, no. So we have been watching you and all the preparation. So I think that paid off. The practice. So you all three have done very well in the preparation. And once the preparation is good, so obviously the success will always reach you. So we are very happy for all three of you. And
Thank you, sir. Thank you so much, sir.
Thank you, sir.
thank you.
Thank you. Thank you, sir.
So without much uh, thing, we will start our session. So all three of you will start since all of you are on the same station, similar, no? So one station we will move on. You can tell what was the scenario and how you tackled anything different the examiner asked. So that will help for the candidates to tell them. The routine, I think everyone will be preparing. So the small, finer things which you want to convey to the future candidates, it will be helpful for them. Yeah. Okay. So I think Dr. Shajita, you can start and we will rotate each station. Okay.
Yes, sir. My first station was clinical, and my first clinical station was CMS station, sir. And my command was to do motor examination of the lower limbs, and it was straightforward Duchenne muscular dystrophy case. So there was no confusion at all about that. And uh, immediately, like, all we have to do is follow our format, and we will definitely be able to find out what it is. So right from the restart, and the leg gate backlash diagnosis was established. We saw the pseudohypertrophy and waggling gait. And once you see that waggling gait, if it did a go worse, then it was done. Um, what the examiners expect in all my station, what I felt was how you interact with the child. So you have to be very polite, make sure that the child is not having any discomfort or in pain because of us. That is the one main thing that I expected, sir. Because as soon as I finished the examination, I heard feedback from my colleagues that they had forgotten to do plantar, they had forgotten to do that this, but ultimately everybody had scored full, I think, in that scenario, because all they expected was the child had difficulty in sitting and getting up and everything. They noticed whether we were empathetic towards the child for that. That is what the main thing was. And questions were all standard, so there was actually there was no difficulty in that um, clinical station for me. It was good. Yes.
Okay, okay.
Mm.
Maybe we can finish off all the clinicals, then
Mm.
Harry can tell
Okay.
I
clinicals.
had the
Okay, sir.
same case, actually.
Ah,
Mm.
okay. Then
So, yeah,
neuro, we can
yes,
go
sir.
Mm.
one by one. Okay, you can
So
add.
I was the one who missed this plantar, sir. So the
Oh,
like as the case was very much evident, no, you'll just jump to the diagnosis. Even if the case is very straightforward, I say like it is better we complete the examination fully. And then while summarizing, while I was summarizing, I said, sir, and then plantar, I said, forgot to see the plantar, sir. In this case, I expect a mute or a plantar flexor, like that I told. And he was okay with it. And in the management, so we discussed everything. He wanted the particular word, multidisciplinary team approach. He asked me, and then only I said, it is a multidisciplinary team approach. That was the only thing which I felt, sir. Other than that, Shajita said, he was very much considerate about helping the child getting down, getting up, and all these things. I think much the same patient, same examiner, sir.
okay. So plantar you didn't do, but examiner
Yeah,
was
I said I didn't do plantar. In this case, I expect new plantars. I said he said, yeah, I would miss. He also agreed. What I suggest is, even though we know the case, it is better we do everything and because it was enough time, sir.
go as per the template. So
I was
do everything as per the template. And suppose if we forget, it's possible actually at that exam stress, it's possible. And at least you remember and verbalize. I would like to do the plantar, and I expect a plantar to go down. So that much we should be able to tell. Yeah. Good.
he didn't reduce any mark for that
The
also.
small things, sir. Like that same child had some plaster on his ankle, one of his foot ankle,
Yeah.
some procedure or some wound. So I said, I'm not doing plantar in that leg because I think it will be painful. So he left off. So I think it is very essential that we be empathetic towards the child. Once I did the Govas, I helped the child get up and sit down on the, made him lie down on the cot. That is all they are expecting, I think so.
Yeah. So in the comments, it's asking what was the diagnosis by the one of the.
It was Duchenne muscular dystrophy. He said 5 years old child, difficulty in walking, tripping and falling off frequently. Had this Gower sign, cough hypertrophy, everything.
Yeah.
He asked for differential diagnosis of proximal myopathy. He asked if it is a myopathy or neuropathy. And one more question was, what do you call this approach as? We said multidisciplinary approach. But he was asking, like, he was not satisfied with all the teams. Like, even after saying all the teams, he kept on asking, what are the team, what are the team? Genetics, we told, pulmonology, everything, Ataluran, all the gene therapy, everything he told. Then he kept on asking, but he gave marks ultimately.
Okay.
So that was that station. Almost like I was just following Sajita after video. So all my cases were similar to it, except for one station.
Yeah. So the Dr. Sasi. Yeah, the case was Duchenne's muscular dystrophy, Dr. Naushin. Duchenne's. And Dr. Sasi Rekha, neurology, yours. Dr. Shashi Rekha, are you there?
Yes, sir. Yes, sir. Actually, I too got TMD, sir, but I made a mistake there in the initial part itself, sir. I don't know whether it was the same case, but the child which I got was lying on the bed, completely covered, and he was like very emaciated and sick looking. So the comment was to do lower motor examination of the lower limb alone, sir. So I thought, okay, I assumed myself, when inspected, there was a calf hypertrophy, and I assumed that the child will not be able to walk because the child was very sick looking and he was like completely covered in the blanket. And so I thought he is sick, so I won't ask him to walk. So apart from that, I finished everything, till everything. And just when I was about to summarize, the examiner was like repeating the.
So I think Dr. Sasi Rekha left. Okay, Dr. Sajita, you can continue with your second case.
My second case was serious cardiovascular, and the child was very sick looking, like the child who just now got out from PACU or something, and very uncomfortable, I should say, to be examined itself. But then the examiner kept on like driving. Okay, what next? What next? What next? I felt like I have definitely got nothing marked in that station because whatever I said, she kept says yes. What next? Anything else? Anything else? And finally, I told I'm having a diastolic murmur in the aortic area and pulmonary area. Probably it is a AR or PR is there, ma'am. Along with that, I'm hearing a systolic murmur here. And I told it is a MR with AR. And then she said, okay, if it is AR, how will you manage? And finally, she asked, do you think the child is in failure or not? That was I felt that I missed the child being in failure, but I got 7 marks in station. I don't know. There was clearly a pen with the liver marked in that child, and while examining, I found that the child was tachycardic also. While measuring the pulse rate, I found that the child was having tachycardia also. But then, when committing, I said, "No, ma'am, there is no liver, there is no edema, there is no. The child is not in failure." No, I said. So I thought definitely I would lose mark there because identifying failure is a very basic thing, I thought. But in my comments, she had written the candidate has commented about parasternal heave when there is no parasternal heave in the child, and she had reduced 1 mark for that. So I got 7 marks in that station. Yeah, yes, sir. But it was very difficult for me to identify the murmur, or to even I was even scared to commit that was a diastolic murmur because I've never confidently diagnosed a diastolic murmur ever in my life. So, but somehow I think it was an AR with MR.
Yeah. So I think here two things take home points. If I say what we think is different from the examiner's
Yes.
perception. So we think that we have done a lot of mistakes, and
Yes.
we are more critical judge than the examiner, I would say. So
Maybe so.
so and that will take after effect to the next station. So don't do that. No, yeah. So we might be a bit upset. Okay, we have not, but the examiner has given good marks in that. So never think that the examiner is judging in the same manner as we have done. So that is one point. And second, I would say, I think clinical, we have to see more cases.
Yes.
So Dr. Naushin is asking what was the case. It's a combined case. Was it aortic regurgitation, mitral regurgitation, rheumatic, probably, with failure?
Probably, sir. That is what I said, and she agreed with the diagnosis also.
Okay. So it's a case of.
Now, when I committed initially only the diastolic murmur and said AR, but then she kept asking anything else, and I said I'm hearing a separate systolic murmur in the mitral. That is probably an associated MR, ma'am, and she agreed for that.
And we should also think that even in the Mark BT, rheumatic fever is not there. So in India, it's very common. So we have to prepare for some diseases that are very peculiar to Indian scenario. So like this rheumatic fever, it will not be there in Mark BT. So we have to prepare for that. So that is another point. And Dr.
One thing I want to tell, any murmur about the nipple, like in the aortic pulmonary area, it is best that if we time it with the carotid and Caesar, because without that, it is very, very difficult to say if it is a systolic and diastolic murmur. Only with that, I thought it is a diastolic murmur. Other than that, it was very similar to a systolic, maybe in the hurry.
Yeah. Dr. Hari, for you, doctor.
I also got the same case, same sick patient. He was half asleep, sir. Comment was a CVS examination, 11 general system examination. I started from hand, but that itself she didn't like examiner. She wanted to specifically examine the chest alone. That I realized when I searched for the torchlight to examine the oral cavity. She kept rushing me to the chest. And in the examination part, she has reduced 1 mark for unstructured examination. So, like if the examiner is very particular about examining the chest, it's better we do the chest first. But otherwise, started from hand, fully did the examination, but still she felt it was unstructured. And the child was having a heart rate of around 150 to 160, sir. And I could not space out time the murmur if it was systolic or diastolic. With that much tachycardia, I was keeping my hand in the carotid and trying to time the murmur, but that was not possible for me. So I said there is a systolic murmur in the apex, and one other murmur along the left sternal border, but I could not time. Child is in cardiac failure, like that I told. She told candidate missed prominent murmur along the left sternal border, and he said MR, but that's not correlating with PSM. But I could not understand what feedback she has written. But the crux is only this much, sir. She was uh, expecting us only to examine the chest and tell the findings. Even when I started telling the
What was the task she gave? Did she say
she
examine the
while
chest?
telling me, she told cardiovascular examination with relevant general examination. I started from hand, but then she was quite okay. By the moment I searched for the torchlight, she became very upset to do the chest examination like that, she told. And then, while summarizing again, child was having IV cannula, ECG leads. He was an obvious cardiac failure. Started with child is looking severely thin. He's having IV cannula mark, chest leads. He is visibly tachycardic. She was like, tell me the cardiovascular findings. Then I started with the mitral area, and then I said there was a murmur along the left sternal border, but she was not liking it. I felt the whole station was a mess. I scored only 3 in that station, sir.
Okay, so that was the one place where you got less marks.
I lost 5 marks there.
So I think here one thing is maybe the important general examination we should concentrate rather than looking into everything. Like you want to look into the dental oral hygiene, right?
Yes, sir. In cardiovascular, I thought I have to look into it. And I also heard from somewhere if they have kept something on the table, we should utilize
We
it.
have to use it.
And there was adequate time also, sir. Cardiovascular station, I had adequate time. But she was in a rush to go to the management. I think examiner was trying to help
You are
only,
not wrong in the way you went in the systemic manner.
Yeah, that was
systematic manner only. But I think clinical examination
I mean, whatever she decides is the
examiner.
thing.
Yeah.
He has reduced 1 mark in the exam. But even though I didn't commit AR, she gave full marks in management because, anyways, MR or AR, the child is in cardiac failure. I told cardiac failure management, valve replacement, infective endocarditis prophylaxis, bed rest, and also the management part, she marked full marks.
Okay.
Yes, sir. That is how, if it is matching with their thing, they are giving marks.
Yeah. So I think clinical, looking at the pulse of the examiner is very important. If they're able to catch the pulse, so they usually give some warning. Doctor, you examine the CVS. Then quickly you move on and start examining.
I should have, sir. I should have.
They try to move very quickly to what they want. So they usually give some instruction. Doctor, I told you to do. Many times it happens. CNS, no. So we tend to do all the any shunt is there. How is the head? They will say you examine the CNS exam. You examine the tone power reflex. So they might be expecting that alone. Yeah.
She was initially patient only, sir, till I searched for the torchlight. There only she got so upset. I felt.
Okay. And Dr. Sasi, your both cases you can tell, doctor.
Yes, sir. Sorry, sir. It got disconnected. Yeah, in CNS, yeah, sir, I made a mistake where I didn't look at the gait of the child. I myself assumed that the child is sick looking and he is bedridden, so he won't be able to walk. I finished completely everything, and then I was about to summarize. At that time, ma'am was like repeating the command. This child has difficulty in walking with frequent falls. Do the CNSA. She was telling it again. So I was like, why is she telling it again? Am I missing something? And then I asked the examiner, will he be able to walk? Yes, he will be able to walk, she said. And then only I did the gait and I did the goer for that child. But she didn't reduce mark for that for me. So whenever the examiner, like you said, sir, whenever the examiner is stressing on something, it means that she is trying to help you out. I should say that throughout the entire examination, throughout, like not only in clinical station, but in all the other stations also, it felt that the examiners were only trying to help us out. So if they are like specifically, like they're pointing out something or they're saying something, we should catch that and come from there. So we are missing something. She is trying to help me. So then I did. And then I finished it, and I thought she would reduce mark for me, but no. So first, the point I wanted to say, don't even it was starkingly obvious the child had that Gower sign, that is the pseudo hypertrophy. We should not be assume ourselves, okay, this is this, so this will be like this. It can be anything also. So just go with a free mind. Don't get fixed. And second is whenever the examiner tells you something, think about it, take a second, and then if you do that correctly, then they are not reducing marks. So even if we make a mistake there. My second serious case was here also the child had both systolic and diastolic murmur, sir. So it was an MVP with MR. So even if we don't tell the diagnosis, like I didn't commit MVP at all, it was not in my mind at all. So, but still, if you tell the differentials, he had given me marks. So other than that, the exam, nothing apart in that station, sir. I went from the hand only. It was a different examiner for me. So I did it from hand, oral cavity, everything I did. So there were no issues in that station for me, sir.
I think in cardiovascular, if you're not sure, I think it is the case of most of the candidates. So
Uh,
we are finding difficulty. Try to
just
go
a
with the
differential
differential
diagnosis.
diagnosis.
Yes, sir.
Even in my exam also, I had a pansystolic murmur, a small child. It was heard almost everywhere. So I gave it like a 5-year-old child. So pansystolic murmur, VSD or mitral regurgitation. So both ways they accepted it. He asked if it is VSD, how will you evaluate? If it is a MR, how will you evaluate? So like that only, I think a differential diagnosis is
enough.
important.
Yes, sir.
Not for the obvious thing.
Yes, sir. For DMD, for that
obvious.
and all, we can't. Yes, sir.
It is very obvious it is a thalassemia. You cannot go and I would like to give a differential. Like, if you're very clear, give it. If you're not sure, try to give a differential diagnosis. And if one of the main diagnosis within the DD, I think they accept it.
Yes, sir. Yes. So yes, clinical. I think we think that we won't have time to finish the complete clinical, but actually, if we have practiced well with the flow, the time was adequate to me. So there was no rush, nothing at all was there. And language also we thought would be a barrier since we attempted in Bangalore, but I think that was also okay.
Okay. And Dr. Shajita, remaining 2 clinical cases.
Yes, sir. The third was abdomen. That was also quite easy, sir. Like to look at the child itself, the child had a hemolytic species. It was a straightforward thalassemia case, and the sir was also like he didn't interrupt me anywhere, and whatever I said, he agreed and got given me full marks for that. I did not have any difficulties in that station also, sir.
So the clinching was the hemolytic phases.
Yeah, yes, sir. Yes, it was a 15-year-old boy, and hemolytic facies was there. And then management, rather than on the hematological part, it concentrated more on the psychological aspect, educational help. His stature was short and delayed puberty. That was the first thing I addressed, and then I will take the hematological opinion to support this. And time got over, but I got full marks there. So that was no issues there.
Okay. And others?
Sir, I got a different abdomen case. Like we just changed the case by then. It was
Okay.
5 years old child, and the comment was she is in hospital follow-up since 6 months of age. Do her abdominal cavity examination. There I got preoccupied. It was thalassemia. But when I examined, child was short, had multiple IV cannula marks, but not pale, so not at all pale. And she was not having thalassemic phases, and then she had a huge spleen up to left iliac fossa. It should be almost left side fully. It was spleen and firm hepatomegaly. So he asked for the differentials. Again, I kept thalassemia as the first differential, HS as the second one. And then he kept on asking for differentials. By then, I didn't commit storage disease at all. I said it can be infections, EBV, extrahepatic portal venous obstruction. Now the child might have got transfused. That's why she's not having anemia like that. And I told. He went on with the discussion and finally asked, do you want to say something to the parents? I said about genetic counseling and all. There also, like, I didn't lose any marks, but I was very much worried. I didn't commit gotchas. By the moment I left the room, I felt it was gotchas. Because she didn't have, that was the thing, sir. But he was.
In the comment?
Nothing, no comment was there, sir. He was very happy with whatever I told, but I felt it was gotchas. because child didn't have thalassemic faces at all. She wasn't that pale. It have been for enzyme replacement therapy also. That was a huge spleen for a 5 years old child. By then I could not commit, but I was very considerate with the child. I played with her and all. So I think they just look into the approach more than the differentials. Like
Hmm.
he asked
Uh,
if he said,
Maybe a differential diagnosis could have helped, right?
I
Giving
said everything except the storage disorders.
okay,
The
okay.
moment I left the room, I thought, "Ayyo, this is gorgeous." I thought I'll not get any mark in that station, but he gave 8.
So again, the perception.
Yes.
We are more strict judges, I think, of ourselves, no, always.
I didn't complete the examination also, sir. I was very much preoccupied with thalassemia because before we entered the room itself, there was one bed with the 5, 6 thalassemia children sitting together, and their plan was to just rotate the children. We saw all those, and I was just preoccupied. So I didn't even auscultate the abdomen and all. I didn't
It's
percuss the
also
abdomen.
very common cases. I think in
Yeah,
abdomen,
sir.
it's like in India, 80% will be thalassemia. In neurology, 80% will be cerebral palsy. So these are Duchenne's. The remaining
Yeah.
20% is Duchenne's. So we get preoccupied, as you say,
Yes.
but are we missing something? So we have to be very careful in that.
I felt very bad after doing that station, sir. I didn't complete the examination because I was just preoccupied with thalassemia. I didn't percuss, I didn't auscultate. I was very much worried. But I think their perception is quite different. The way we treat the child matters a lot, I believe.
And the examination technique. So those
Yeah.
things, how we are examining, so the technique, ability to elicit the findings. You are able to pick up the spleen, liver. So that's how they split up, right? So
Yes, sir.
technique, ability to identify the signs, then putting together,
Yes.
and how you are thinking. So those things.
I didn't fabricate that she was having pallor. That also I told. Child is not having anemia now. Probably she got just transfused. I said this and substantiated myself. Then only I realized it was not thalassemia.
Okay. Okay.
Yes, sir.
Yeah.
That was the thing.
And so Dr. Shashi?
Yes, sir. It was same TAL for me. It was a typical case, sir. I didn't have any issues there, but one of my colleagues who went to the exam, it was actually Piyush Gupta, sir, on that station for us, abdomen. He was
Okay.
quite calm only, but what happened was that candidate he was a boy, 15-year-old boy. So without thinking, the candidate tried to examine the genitalia of the child. It seems. So that time, Piyush Gupta sir just blasted the candidate. I don't know whether he reduced the mark or not. So I think that the privacy of the child matters, the comfort of the child matters. So anything that goes, it will make the child, because he is a teenage boy. So at that time we have to in that tension, in that stress, everything happens, but that shouldn't mark us negative. So I thought, okay, that was the only thing that happened in that station. So other than that, everybody told it was TAL only. And apart from TAL, Piyush Gupta sir was asking okay, if it is not hemolytic, what other differentials would you give? So I told EHPVO, because some of the candidates, their first diagnosis itself was EHPVO, but the child typically had hemolytic facies with jaundice and all. So he was just asking if it is not TAL, supposing what other differentials he would say. So I said EHPVO, and he didn't write any comments for that also, sir.
Okay. So I think one important message you have said. So privacy of the patient,
Child matters.
privacy of the child matters. And although abdomen, we always say, so the 10th quadrant, we have to
Yes.
that we can verbalize.
Yes, sir.
Verbalize. It doesn't look nice like 10 candidates, each one peeping into the genitalia of a child.
Child.
Always verbalize that I would like to look into the genitalia, but better avoid.
Yes, sir. Yes, I mean that tension. I understand it happens, but yes, sir.
And actually, In India, it's like sometimes we take it for granted.
Granted, yes, sir. We don't ask the patient for
Yeah.
permission only.
And all, it's not that easy to examine
Yes, sir.
the genital. We have to take proper permission. Only if it is deemed necessary, we have to examine.
Mhm.
Yeah.
Yes.
Okay. Dr. Shajita, the last clinical station.
It was a 5 year or 6 year boy. The child actually the differentials we gave were JIA, and that is what she discussed about also. There was no they did not understand anything I talked about, and then immediately the examiner asked, "What language do you know?" Then I told I know only English, my mother than my mother tongue, and immediately she arranged for an translator, and the translator was also very much helpful. And the child did all the maneuvers for the MSK, and the child had swelling and stiffness and limited range of movements in almost all joints like knee and wrist and the neck. And I think that is what the examiner actually concentrated on every other candidates also, whether they are able to identify the limitation of a range of movements in the jaw and the neck also. That also the child had, and my first differential was a polyarticular JA, and she discussed about it, and that was about it. So, like I initially started with whether the child has any pain, and that time I understood that there is a complete language problem, and then the translator was brought in, and I went on to ask about whether there is any stiffness or the screening questions. But then she told, this is not a history station, this is a clinical station. Go out to examine. And then I left it there, and she didn't want all other candidates also to ask about it. So maybe one thing that we can do, if at all is an MSK station, is we can ask the examiner initially itself, sir, can I ask the screening questions and then proceed.
Yeah, I
But
think
that's it.
permission
But
is
she had,
better. Yeah,
yes,
permission is
sir.
better. Even though we are told very clearly that MSK is the only station where 3 questions we have
I
to,
like to have history, yes, sir.
but that examiner should know. I think that is
Yes, sir. I felt like she expected like the bare minimum, whether we are able to identify the restriction of movements here, say GIA, and while in discussion whether we are committing about the uveitis thing,
You
steroids,
had
that's
any swelling? You were able to make out any swelling, tenderness, or
there
only
was no
no?
there was no tenderness, sir. No, the child had only restriction of movements,
So
and
you did the
I
whole
didn't go about.
physical.
Yes, sir.
You did
Only passive I did. I did not try doing any active to find if it is like PGALs I did, and by the time I did PGALs, the time got over, and thankfully, in PGALs itself, all the joint range of movements were identified,
yeah.
and it was
I
done.
think in the others, if we get MSK, it should be a reasonably good station because we have maneuvers to demonstrate. So to
Yes,
say
yes,
the
yes, sir.
examiner that I know things. If it is a like unknown syndrome and all, no, so then that will be a kind of difficult
Yes,
to.
yes.
Dr. Hari,
Mhm.
Yes, sir. I am particularly the examiner was very good, sir. The moment I entered, she asked if you know Kannada or Hindi. I said no. Immediately she went out, got one translator, came in. Meanwhile, she said you can examine whatever you want. And then when I came in, she said it is a musculoskeletal station, and she is a translator. We just talk to the parents like that. She said. And then I said, ma'am, I want to ask screening questions. Okay, then I will answer the screening questions. She told. I asked the first question. She said no pain. When I asked the second question, she said it's not a history station. It's enough. You can examine.
so same for everyone.
Yes, I asked herself only, and she was ready to answer the screening question. She was very much considerate for the candidates, sir. Like, and then we systematically did the P girls. When there isn't any finding,
Each time she went and brought the translator.
the moment I entered, she asked, "Do you know Kannada or Hindi?" I said no. She said, "Don't waste time. You can start doing the musculoskeletal examination. I'll be back." She went out, got a translator, came in,
Mm.
and she was very good. I should say
But
because that's
sometimes I would feel that better as a choice, don't ask for the translator because the time you might
yes, sir.
time in the process because we have only 5 minutes time. But okay, here you
Mm,
got it quickly. Sometimes it takes time, so better learn the language, some words, especially for MSK, those three.
MSK, it is difficult without knowing the language. In the CNS station, he
Yeah,
himself translated, sir.
yeah.
Even before I did, he understood. He asked the patient, child to sit down. He translated fully. I think that ma'am also didn't know the Kannada or Hindi. She was from Chennai, I think, sir.
Okay, okay.
So that was a very nice station. If there isn't any finding somewhere, she didn't allow to undress also. She said nothing is there. Don't open the shirt.
Mm.
And the discussion was very smooth. That was an obvious case. Child didn't have any pain at all, only contractures and deformity. And I was a bit hesitant to commit neck movements because it wasn't very obvious. Then she said, "You examine, but you're not telling." Then I said, "There is a restriction of neck movement as well." I
Okay,
felt she was very nice.
okay, very good. So we should all pray for such
Yeah,
exam.
such a nice examiner for that station, I should say, sir. The case was a difficult case.
Yeah. And Dr. Sasi?
Yes, sir. I got a girl child. Luckily, she knew Tamil. So I had no difficulty with language, and it was also polyarticular J, so nothing else. Restriction was there, and she had a leg swelling also. So I first did PREMS of the left ankle, and then I went for PGAL, sir. Yeah, that's all. It was straightforward, so no issues.
They had some, on the same theme, they had variety of cases, I think. So they gave MSK
They had a huge
different
variety of
cases,
cases, sir. Huge
different
variety. One
cases on the
entire
same
ward
theme.
was full of cases.
So
Yes,
that's
yes.
good. I think
An
Bangalore
entire
station,
ward was with children.
yeah, Bangalore station, I think if option is there, we should book that. No? So because the typical cases and
Maybe.
one they keep
Yes, sir.
repeating the same. No? Okay, ma.
Yes, sir. Yes. And the examiners were also good, like Hari said.
Okay.
So one thing what I was scared of was what if the findings were very subtle that we were not able to identify and all, but all the cases they kept were like very straightforward with the findings. So it was very nice in that
That
center.
luxury happens when you have that many variety of cases. No, so that is.
Yes.
Okay, Dr. Sajita, next after the clinical station.
After the clinical side, I went for
Development.
was development, sir. It was development, and here again, I didn't know whether I was going to be given marks at all because only the history part he listened without interrupting. After that, everything he kept interrupting. Sir, I wanted to pick uh, the toys. I said, okay, you just say what you will do. 1, 2, 3. That's all. Then I began to ask. He kept interrupting. The child was actually with autism and with speech delay and with some hearing problem. That was all he was interested in. He didn't allow me to complete the development assessment. I was not able to comment on the developmental age of the child because of that. But I got full marks in that because he kept on asking whether will you hear this feeling? How will you? What is the behavior problem you're seeing in this child? I said autism, all this entire autism evaluation that he was interested in. I kept on asking about whether there is rocking moments and whether the child is making eye contact. That autism examination part, he was completely cooperating with me. After that, the developmental age, he did not allow me to assess at all. He stopped me there and he fully asked about autism and gave marks. That's also. So I was very scared that in a developmental station, I did not give any developmental age at all. So I don't know how I'm going to be marked. But whatever the examiner asks, if we are giving the answer, I think it's sufficient and we will not be scared.
Yeah, I think development is one we prepare in one format and
Yes, sir.
examiner
Yeah.
expects something different. But good that he gave the marks. So
Yes, sir.
So I think development we have two different set of examiners. One examiner is very critical and
Yes.
they are taking down the marks because it's a high scoring station. 12 marks are there. If it is a fine motor, I think not much of an issue. So social and language kind of we prepare in one format and
Yes, sir. Even at the end of history, after summarizing, in between summarizing itself, he stopped me and he said, "Go into assessment." I said, "Sir, can I tell the motor age? Is it normal?" "Yes, sir. It is appropriate for age." "Then you go into assessment." That's all. He was not interested in the developmental age assessment at all.
Okay.
But whatever he asked,
Usually
he
they
answered, so he gave marks. Mhm.
usually they expect the developmental age.
Yes, sir. Yes, sir.
Dr. Hari, for you development?
Yeah, so it's the same thing. Here, I want to tell about the role player also. She was also very smooth. Thing is, they didn't allow us to ask too much behavior questions, sir. When I asked if he is always having a rigid routine and all, she said, "Sir, doctor, can you please examine my child?" Like whatever clue I asked about the behavior, she said, "Can you please examine my child?" She didn't answer. Dysmorphic faces, "Can you please examine my child?" Height and weight, "Can you please examine my child?" So in the history, they have clue only for developmental milestones, perinatal events, trauma, family, and like all those important pointers alone. They have a history, sir. Extra things and all, it is better we ask, but most of the time they'll just say do it in the examination.
I think they don't penalize for that. Only you will
Yeah,
not get answers for that.
yeah. They'll not penalize, but I felt the clues were very minimal for them on perinatal events, family events. Like for all the milestones, they had clues, sir. They were like whatever I asked, she answered. Like I asked, like if the child can draw something, she says the child can hold the crayon like adults, and then she can draw my face like that. She is telling. So
Okay.
in those areas, which are very important, they have all the clues. Other areas, you tell you examine my candidate, my child. Like that, she told she left. Likewise, for me also during assessment, he was calm only, sir. I kept saying about hearing, autism, and everything, but finally the feedback was you didn't say about hearing in speech stations. So I'm reducing 1 mark like that. He has written.
You checked.
We kept discussing only about hearing, if at all, if I could remember, because there wasn't any clue at all, sir. He was hearing sometimes he's not hearing. So I asked if there is repeated ear infection. I asked if the hearing test was done. In the management also, I said audiological assessment. Despite it's their thought process. By then, what they
Sometimes
think they are
they don't.
reducing.
Yeah, they don't observe fully. Sometimes it happens like that. Yeah.
But to me, he asked developmental age, everything. With each candidate itself, they are like different. Because it is a big station, maybe he got bored. I don't know, sir.
Yeah. That is it. But as long as they give the mark, it's fine.
Yeah. For me, he was very quiet. He just kept
And
on listening.
this self-care, we had an change, right? So the self-care component came to
History, they're answering, sir. History, they're answering it.
I think that is an important platform. Recently, they have said that don't ask about toilet training and all the self-care in the assessment part. Because
Yes.
asking questions in assessment doesn't make sense. So ask them in the history with the role player, all the self-care related questions.
Yes,
So like
behavior, yes, sir. Behavior related questions alone,
the
they want
feeding
us to do
also,
in the
right?
assessment.
Even
Feeding also, I asked.
also.
Yes, sir.
Feeding
Play
and
alone, we did.
self-care.
Play alone, we did in
Play
the
alone.
assessment. And in the assessment, he said, I'm the mother, I'm the child. Whatever you want to ask the mother, also you can ask me. Like that, he himself said.
Yeah.
Like whatever we are asking, he is saying the answer.
But
We had
he
no
didn't
problem,
do
sir.
the drama of an autistic child, no?
No, he didn't do, sir.
Yeah, sometimes they don't respond at all. Whatever you ask, they don't respond, then it will become tough.
He was very good, I should say. Like whatever question I asked, he immediately gave the answer.
Okay.
Yes, sir.
And Dr. Sasi?
My development was the same, so the same autistic child, but the examiner was different. I had no issues, sir. Here the thing was, even in speech and the social thing, they are expecting us to know infant development, because the child was only around 6 to 9 months age. So that was one thing. And like you specified, sir, some of the candidates were not aware that the activities of daily living should now be asked in the history. So they missed it. And when they went back and asked in the assessment, the examiner was like, I can't answer that question for you now. You should have asked it in the history itself. So some of them were not aware. I don't know how, but yes, so they lost marks there, sir. So apart from there, everything, this ma'am was like, she was standard, whatever we practiced, it went with that flows.
Age came less than 1 year, doctor.
Yes, sir. Yes, sir.
That also is a take-home point. Most of the age is coming around 1
Coming
year.
years. And the ma'am said only ba, ba, ba. That's all the child is saying. Nothing else the child did, sir. Nothing the baby did.
You asked all the items.
All items I asked, and even I asked the mother, what can he talk at home? How is he at home? Can he talk in sentences? No, nothing. Only Baba, Mama, that's all.
Okay, okay. Okay, doctor. So development, that's development. And then Dr. Sajita, after development, history.
History, sir. Yes, sir.
Language.
History station was smooth, sir. It was oligarchy of JA. The case was JA. We had some differentials. It was like there was
English.
pain in yes, sir, pain in ankle or knee joint. Some one joint alone they had given, and on probing they revealed that the other joint was also involved. Two joint was involved. It was a straight, and there was stiffness also. No other significant history, no confusing thing. It was a straightforward JAU, and all the discussion was also about JAU. Yes, sir. Actually, the discussion got over. It's some at the end. I had some 1 minute or 1.5 minutes, but then examiner said, "I'm done with you," and we were just sitting. That's all. What if they are actually having a list of questions that they are supposed to ask, or they have prepared themselves? We don't know, sir, but they are just looking at it and asking it. And
I think it comes
even
as
if that
a
is
key. It comes as a
okay,
key.
sir.
History will
Okay, sir.
be-
Then after that, if there is time, we are just convinced with it, and we just sit there simply for some time. I sat like that for 2, 3 stations. I simply sat for 1 minute and came out.
very fast. Fast to move around. That once you practice, you will be a bit faster. Yeah. So here in that 9 minutes, what were the questions? Like what problems, what investigation, like that?
Yes, sir. She asked about what was the problem list you have elicited, and then she asked what is your differentials. I said JAA and some other thing I don't remember. And then she asked, can it be infective cause? I said there is no fever in the history, but it could still be thought about. I think, ma'am, but it is less likely because there is no fever at all. I said that, and she accepted it. And then she asked about what investigations you will do, what drugs you will put, what are the team of doctors, and then what ophthalmological complication do JAA end up with? She expected both, like the of the uveitis and of the treatment because of the steroids, cataract. Both she expected, and that's it.
Dr. Hari?
Yes, sir. The same questions ma'am asked. And history also didn't have much clue, sir. Even history taking got over so soon. I had around 1 minute left. And they were also okay, sir. If you want to ask any further question, you can go like for me, she said, you can go through whatever you've written down and ask if at all if you have missed anything. And then I went through whatever I've written and I said, no, ma'am, I think I've asked everything. Then the role player left. Then there was enough time, sir. Then she was like very calm, asked the differential diagnosis, how will you investigate, how will you follow up? And for me, I had 4 minutes left after the discussion. After 1 minute, like last 3 minutes, they'll give a bill, right, sir? By then, she thought the station was over. I went out and they said, I had 3 more minutes. So I was
you came back.
sitting, and then she was asking, where are you from? You know that doctor, this doctor. Like she kept conversing for some time, then the station got over.
That matters a lot if we get such a good examination.
Yes, yes, sir.
Our
And
nerves will be better for at least for next station and all.
and they don't have much information in the history, sir. Like I felt like while we practice, we used to have more information in the history. Maybe it differs between stations, but I feel like it is all like
Because I have seen the script actually. So
yes,
even the development script also, it goes in like 5-6 pages of
yes, sir.
to the role player. Role player gets like too many pages. So maybe they are telling less.
Yeah, sir. I felt because we asked almost all the questions. Development also we had time. History also we had lots of time. So maybe it's an acute history, so we had time, I feel.
Yeah. maybe. And a teenager is not a teenager, right?
Yeah, we asked hits. I asked hits. 11 years or 12 years. I asked everything.
Okay.
Self farm also I asked, like, because
That is
father
the
was.
practice. I think the practice. So you have been preparing for such a long time, and so you are able to finish off quickly. Yeah.
In the station, what happened was it was the father, sir, David. David, father of some person. It was like as we practice for mother every time, I said, I hope I'm with mother or such. And he said, no, I'm the father. So
Mm.
that can happen. We have to be very careful.
But the role player was sex was different. Huh?
No, sir, it was a boy only. Since we practice, like we always talk to mother, like, it
Maybe
came
they
out
keep
of
like
slipped out of my.
mother, they keep a female role player. Father, they keep a.
They kept male only. It slipped out of my tongue, and he was immediately, I'm the father of like so and so. Like, I'm really sorry for committing it. So then he got convinced, examiner law. It should not happen, sir. But
I
like we
think
should be
that is
very
an
conscious.
important thing Dr. Hari is saying. Sometimes examiners will be very strict, and after doing
Yeah.
all the hard work of taking history, discussion, just by the name and the sex itself, we will lose marks. So write down in a paper when you're outside itself who is the child, what is the age of the child, who is the caretaker, and as he says, father can be there. And sometimes in development also, never assume that it is the father or mother. It could be a grandmother, it could be a foster carer. So be
Yes.
very open to think who the. So read the statement properly and write it down. I think that is important. Yeah.
Even if the examiner is not minding, role play will definitely
Mm,
highlight things.
yeah. And then the examiner
Because
will
she didn't
see,
mind, he was only annoyed.
yeah, examiner will then realize, okay,
Okay. Yeah, sir. That was the thing.
okay. So Dr. Sashi.
Yes, sir. Same history, no issues, sir. The thing is, even if we don't know much theory, also we can manage. We need not know in depth about everything. So whatever knowledge we already have from our post graduation, that is enough. That is more than enough. It is all about the time management and also our tone. Like if one of our colleagues, like they had written that it was a tone was very intimidating, and she was very intimidating by asking so. But so that is how we talk. How we talk to the role player is all that matters in all this history taking, sir. So knowledge doesn't
We
matter
will be
that
in a
much.
hurry. No, we will be in a
Yes,
hurry
sir.
to finish off, and how we talk might.
That might sound odd to the examiner. So yeah, so confidently you can manage that 9 minutes, sir. It's not an issue. So
I think
history, the
here
only thing
the
they take.
ability to listen and converse, empathize. So those all get 4 marks.
Yes, sir.
They-
Yes.
Yes, sir. We need not rush at all, sir. That's what I mean, I tell to all the stations. The information they have is like adequate for that time. Like we need not rush on anything. We can take a pause, empathize. We can do everything. Like we need not
Mm.
rush the
Then
role
four
player at
marks
all.
is coming. Four
Yes,
marks is coming. How we
yes,
are
yes, yes.
our interviewing skills, no, so that is important, whether we are empathy. So if they talk about my uncle expired, then we should be in a position to say, I'm
Yes.
really sorry for what happened to him. We cannot, okay, uncle died and you just move on. So
And we need not rush at all, sir. The time is very adequate. If you're practicing for the right time, time is very adequate, sir.
okay. And Shajita, next history development over.
So, communication, sir. Communication first scenario was talking with the student about actually initially there was a scenario case scenario was given that so and so was admitted this and only the last line of that paper it was given you'll have to discuss with your junior about a pathogenesis of dengue. So it is very essential that we read through the scenario completely and uh, actually grasp what the scenario is. And so that is the one main thing. In both the scenarios, only the last line had the clue what communication we are about to enter into. So that is very important.
And the
I
scenario
said.
was big. Scenario was quite.
And the scenario was like 7 page lines. Yes, 6 7 lines was there. So yes. completely about the platelet count, everything, how the child is now. And yeah, it was a scenario for about 6 to 7 lines. And
It
only the
is
last line that we had to discuss with our junior about this, the student about this. Other than that, I have never practiced that scenario before. Everything I spoke was whatever I heard from my PG period. I spoke about the dengue pathogenesis, and in both the scenarios, I didn't have time to complete my scenario. So, the first one with the student, I offered some leaflets, and if there is any doubt, you come back. Maybe I had a closure. But the second scenario, I didn't complete at all. But the most important thing here is we have to keep asking them, is there any other concern? If at all there is any concern unaddressed, then that would be a problem. It doesn't matter whether we are completing the closing,
whether we
like
are
we say,
summarizing or not. It doesn't matter.
summarizing leaflets, everything, yes, but it matters that whether we have addressed all the questions or concerns that the role players has. So once the bell goes off, like only 3 minutes is left, we need not be in a hurry to summarize, but we can put forward a question. If is there any other concern that I should address now? If no, then we can proceed to summarize. If at all they keep asking questions, it's a must that we have to calmly answer those and not rush off to go to a summary. That is what I can say. But I would
Yeah. And in this talking, that will be the medical education scenario, right?
medical education, yes, sir.
Uh,
Whatever I knew, I told. But once I told something,
you draw
I just
something,
think
you drew something,
for
explain.
dengue pathogenesis, I don't draw anything, sir. No. Hmm.
Uh,
Now that you
for
ask, I
the,
don't know whether anything could have been
but for
drawn. But
the patient education, we better draw.
we usually draw. It's better to draw. Yes, sir. I didn't draw anything. It was actually
Then,
pathogenesis of thrombocytopenia in dengue. So I don't know
and
what I
one
could have done.
advantage, we can talk in jargon.
Yes, sir. We can very much. That is a very. It was very lucky that we had a medical student scenario. Yes, sir. And whenever I felt that my knowledge is maybe wrong, I added one more thing. Maybe I'll refer more and come back to you if this is right.
Even
I
it's possible, like
pretended
to
that
say,
I kept telling it. Yes, sir.
yeah, you can go and look into and come back. Why not you
Yes, yes.
read this?
Twice I used that. She asked about when will you transfuse platelet. I said only if there is bleeding manifestations, or if there is no bleeding manifestations. I think it is less than 20,000, but I will better go refer and come back to you. That I said that because I don't know whether there is a separate UK guidelines for dengue and all. I didn't know. But I knew
I
what I
think that
told,
is the safer.
and then I told I'll better go and refer also and come. I'll make sure.
Yeah, I think the safer way is to commit something. So I think,
Yes, sir.
to my knowledge, it is. But however, I will look into the literature and get back to you.
Yes, sir.
Rather
Yes, sir.
than saying it is 20,000 and you have to transfer.
Yes. And we need not be very afraid to commit also. We can just commit whatever we know, and then we'll say we'll go back reference
Yeah,
and if we
yeah.
know if it is.
It's not nice to say everything. I will look back. I will look back.
Yes, sir. Yes, sir. Yes.
Have to tell something, but you
Something. Yes,
have
sir.
to give that uncertainty. You need not tell confidently.
Yes,
Uncertainty
sir.
you tell and say I will look back, or why not you look into it as an assignment like that. Yeah.
Yes, sir. Yes.
Dr. Hari, yours this medical education scenario.
Yes,
Any?
sir. Even I didn't practice that scenario at all. And by then I didn't know about like what exactly to tell about the thrombocytopenia also. So I asked the medical student if she knows already anything about the dengue and all. She said, I don't know anything about dengue. Then I started like fever, 2 to 5 days, it will be there in a tropic, like that I'll explain. And then she rightly caught me there. You just tell me when will you transfuse platelets? Again, I told most of the clinicians do it below 10,000 or if there is bleeding manifestations, but opinions differ. If needed, we may go into research like that. I told and she was convinced because I was also not sure if it was less than 10,000, what guidelines they had. I said most of the clinicians do transfuse below 10,000 or a child had. Then she said there was a child of whom she was treating. The child died in the ward. because they didn't transfuse platelets. Then I said, I'm really sorry you underwent that. That must have been really difficult in your residence. No, I said, and then also I didn't answer that question. I just acknowledged her emotion and moved on to the other thing. And by the end, I asked her to summarize, and she was, Doctor, can you please summarize? She asked me to summarize. Then, okay, no problem. I will summarize for you. And then I said about mosquito preventive measures and all. She asked, like, how do you prevent mosquito, repellents, all those things. Like she kept asking. She had so many concerns, and she was not willing to summarize also.
Okay. So that was it. And Dr. Sasirekha, anything you want to add?
No, sir. It was like straightforward. Nothing. It was quite, as long as it was not an angry father, it was okay.
Yeah. So usually we get one like this information giving, and one will be a challenging scenario. So
Difficult scenario.
the next one, Dr. Sajita, you had a difficult scenario. Next communication.
It was the scenario was
HSP.
Rhinostrum purpura HSP, but the mother was concerned that it was only when we go that we knew that the mother was concerned it could be a meningococcemia. The stem was like it is a HSP. Go talk to the mother about it. Reveal it. That's all. After that, mother in between while I was telling what HSP itself, mother stopped me, interrupted me, and said, "No. I had one more neighbor, meningococcemia. We start antibiotics for the child." So it was like convincing the mother that it is not meningococcemia. We'll have to highlight about the red flags of meningococcemia, and it is not this adrenal. But this mother, she had a lot of questions. Here, I did not have time to complete the scenario. She kept on asking, like, will it occur again? What will be the long term problem for my child because of this? And what if you are not starting antibiotics? What if it is actually meningococcemia? How to take care of my child at home? So many questions she herself put forward. We'll just reassure and calmly explain to her how to follow up the HSP. I think the guidelines knowledge helped a little here to talk about the
Sometimes
follow up
they check
and
that.
everything. Yes, sir. Yes, sir.
Even in communication, they check your knowledge of
knowledge.
content.
Yes, sir.
Dr. Hari,
Yes, sir.
anything you want to add to that?
Yeah, all the concerns were guideline questions, sir. She asked, how will we follow up? Is there recurrence? Like that, she kept asking line by line guideline question. Like, but she didn't ask by herself, sir. Only when I asked if she is having any further concern, she asked one by one. But I was able to complete the station. By the end, she said, "No, doctor, I think I'm done." Then I said, "We'll
guidelines, but you have to give the information in a common man's language."
Yeah, sir. She had, how will you follow up? Will it recur again? She said, the child is having one more sibling. Will it spread to her? Because rashes tend to spread. Will this rash spread? No, it will not spread. Like she had so many questions. What all things you will monitor? Why do you do a kidney test? Why do you do urine test? Why do you suspect
outside the station? It was not mentioned that.
It was just said child got admitted last night. Child is having HSP. BP is stable. Urine examination is normal.
Yeah. So what happens? I think this scenario I also got. What happens? We sit outside and we start drawing how to explain HSP and all. And once you go inside, it will be totally different. So mother is worried about
meningococcemia. Yes, sir. Exactly.
So we should not go with our own agenda. So what is her agenda and try to address that rather than we going, let me explain HSP, straight away. Then we start explaining everything, and finally, mother says, "That all okay, doctor. I'm very worried about meningococcemia. Then we will be in trouble." So I think
actually, this saved me, sir. I drew kidney and kept the paper somewhere, and went with the blank paper. If you can look into this diagram, I actually had no diagram. Then she was, no, I'm not concerned about that. I want to know about meningococcus. Thank God, I felt it was actually going in that direction.
Yeah, so that only. So we prepare outside like this only. Okay, we'll prepare for information giving, because nowhere it is written that mother is worried that it is meningococcemia.
She pretended like she's very much concerned, so she was very sad and all.
So sometimes the role players are smart enough or they have some empathy on us and they steer us in the right direction. But sometimes the role players, they hear all our stories, and when time is going to be up, they will say, "No, I'm concerned it is an angel of sin."
Divide
So in
also,
that
I
way, the
think
role player was actually very
Good.
helpful, good.
role
In the
player
Mm.
also
HSP
we
role,
should
role play is very
classify,
good.
no? Just like examiners, role player also helpful
Yes,
role
sir.
players
Yeah,
and
sir. That is very
sadist role
important.
players.
Dengue role player, she was bit tough because she was very hesitant to open her mouth at all. She want all the information from my side only. I didn't have it also, so I felt she was tough.
Mm.
Okay, then Dr. Sasi, you have anything on this?
Nothing else, sir. It was from top to bottom full guidelines. That's also.
Okay, very good, very good. So reading the guidelines is very important. So anywhere, so if it is in a video station or history station or even communication, if it is a, so try to, the questions will be from the guidelines. So mostly if it is a history station or video station, yeah. So your last video stations, Dr. Sajita, last two things.
My first video station was with Piyush Gupta sir, and it was a 2 months old child with some acute 2 or 3 days history of I don't exactly remember the story now, but the video had uh,
It was
the
2 months
baby
old.
being
Child
inside
noisy breathing. That's all.
the noisy breathing. That's on 2 months old with noisy breathing. Yeah. And then in the video also, there's a child had stridor. There was no cough, nothing. And since it was a 2 month old, I was very hesitant to commit with, but actually that was a primary definition we wanted. So I got 4 marks in that. Uh, but once he brought up if it is a group, what will you do? No, it fully talked about group guidelines. So I think that is why he gave me at least at half 4 marks, or else, yeah, I think around the last 4 marks. Yeah.
So is it
But
like
then
the baby was sick or not?
no, sir, the child was not sick looking. The child was looking around only. The child was looking around, and the child had
Very
that
difficult,
spider
no,
alone,
for a
and there
two
was a
month
retraction. Yes, sir. And
two
there
month
was
old
a
baby to
central
think as group.
retractions group. Yes, sir. All the videos that we practiced group was like the barking
Bigger
cough
child.
with the
Yeah.
audio and everything. Here,
Usually
there
two
was
months we
nothing.
consider laryngomalacia only.
Yes, sir. And but it was an acute history, so I went with maybe it was a bronchiolitis. The child was having these. He was not convinced with that.
Acute history, huh? So it was
Yeah,
written.
it was an acute history. It was a 2 days noisy breathing. That's all.
I think maybe
Mhm.
this history flow is important, right?
Yes, sir.
So
Yes,
acute history laryngomalacia cannot be acute history. So then,
yes,
and
yes.
these videos keep repeating. So I think for all the other candidates also, the stem is important. So acute history, so laryngomalacia will be from right from the early stage.
But
So
yes,
2 day history of noisy breathing.
noisy
Then
breathing.
you have a newborn 2 month old baby with the stridor. So be careful, not just
I gave bronchiolitis or any aspiration of foreign body some because of that stridor airway problem, but I didn't at all open my mouth about group.
so it can
But
be group. So even for a 2 month
it
old
can
baby,
be
also group.
group.
So very important because it keeps repeating. So that's why
Yes, sir.
be careful. So you should, if you are in doubt, better give a two differential. For acute history, I will
Even in the guidelines, the age
chronic.
it did not include less than 6 months for a group. But then it was a very different.
So Dr. Hari, yours take on that.
So this was my first station, and it was Piyush Gupta sir. So the video was 2 months with noisy breathing, and they didn't tell it was very acute and all. I do not remember it as so, sir. The child didn't cough at all. When the child cried, the stridor increased. When the child became normal, it was it was like laryngomalacia only for me also. I explained the video, and then I was about to tell DDs. He said, "We'll discuss about DDs at the end. Tell me the history that we'll ask, and then examination. What will you do?" Then he said, "You have to give me one diagnosis and two differentials. One diagnosis, I said laryngomalacia. Two differentials, I said bronchiolitis, group, and then I said foreign body also." And then he started discussing about group. The comment was the first differential was laryngomalacia, which was incorrect, and he has cut 2 marks for that.
So I think here that acute history is the only
Yeah, yes, sir.
evidence. No acute history of 2 days history of.
Even if it is on the differentials, he is not ready to give mark. He wanted group as the diagnosis. He said one diagnosis, two differentials. He didn't allow us to give a lot of differentials for acute also. He was very specific. And he clearly wrote the feedback also. A 2 months old child, acute history, laryngomalacia DD is incorrect.
Okay. So I think acute history. So that
He has written acute history, but I don't remember it so
It was
like videos
in
also.
the
Yeah,
STEM, it was
It was there. It was written
it
was
was
a
there
few
in the
days
STEM
only.
that it was
I
it
think
was an
the
acute.
STEM is very important here.
Yes, sir. Then in that case,
We don't get the good videos. So even there was a video of a septic arthritis. We will not get a clear-cut septic arthritis. So the child will be playful and all. So I think there the STEM or some way you should go towards septic arthritis or give a differential of both reactive and septic. So there they were telling only reactive and the examiner was discussing about septic arthritis. Although the child was not sick, there was no warm child was playing, but still the discussion went in favor of septic arthritis. So I think they don't get the clear-cut good videos.
it's only for those who said group as the first diagnosis might be I would have given marks.
Sir, even our practice sessions, we had very good videos for group.
And Dr. Sasi, about that.
I had a golden-hearted examiner in the station. I also didn't come in group first, sir. I finished everything about laryngomalacia, and then only he asked, okay, what else would you think of? And then I said, okay, this, and then I committed group, and then yes, okay, now group, how will you manage? So yeah, but he didn't reduce mark for that, sir. But it was given in the outside STEM. It was given for the past few days only. This problem was given.
Recording in progress.
And next video, Dr. Sajita.
Next video, it was very easy, sir. It was a
Yes.
lower motor neuron cell facial palsy, Bell's. That was also given. Outside STEM was there, the age of the child, and presented to ER or something. It was given, and then the video was clear cut.
I think the one video that has been repeated most number of times is Bell's palsy.
It's painful.
So without Bell's palsy reading, I think no one. It got even repeated again in the same station. I think no? In Mumbai again they gave the same Bell's palsy. So it keeps coming so often. I don't know why they are obsessed with Bell's palsy.
Bell's palsy.
We should be happy. So we get Bell's palsy, we will get good marks. So prepare it. So you had no issues, right?
No issues, sir. Everything from the guidelines she expected though, but other than that, no difficulties.
Hari, anything you have to say about it?
Yes, sir. She was having the script in hand and she was reading it like she didn't even question me. She was less, yes, if it is a case of Bell's palsy, how will you treat? She was just reading through the questions. And one new question she asked was like, though it was an easy question she asked, like, what is the rationale behind giving steroids in acute cases of Bell's palsy? She asked. To reduce the perineural inflammation and edema, if at all, that is compressing. Then she agreed. She's having a script set. She's just reading through the script.
The video station development history, you get a script from there. Even communication also. Clinical station, there will be no script. So that's the problem actually. Clinical stations.
Once they're done with all the questions, the time got over and I had around 2 minutes within that station. She just went through the questions like given in the script.
So Bell's palsy, very difficult to stretch even for 6 minutes.
Yes, sir.
And these two stations are where what investigation, just for namesake, we should not say investigation. No? So for
Yeah.
also
She
no
asked.
investigation. Similarly, for group also, we should not disturb the child.
He asked, he was specifically asking, what investigations will you do?
What investigation will you do?
Will you do throat swab? Like that all he asked me.
Wanted.
We should be,
Wanted to target somewhere.
So he was very like feedback also he has written clearly in clear illegible words he has written feedback.
So I think video
Actually, in
station,
feedback, only his handwriting we understood, sir. Every other feedback, we did not understand what they had written. He had written very clear.
I think we should be very clear in video just for namesake, don't say some investigation because many number of video stations, no investigation. So Bell's Palsy, no investigation. And this group also, no investigation. Yeah. Okay, so I think it went well. So all of you have done well, scored a good number of marks. So we are very proud. So how was your preparation? So so what
Nightmare, sir.
if you want to say how much time duration, what all books you studied? So I think how much time you spent each day. I think those will be very valuable things. They should not feel that at the end, maybe I should have spent this much time. So that guidance, I think, Dr. Shajita, you can tell how much time and what all to read.
I had very little time, sir. I was going to work and I had to take care of my child, 8 month old. And so, whatever time left, I had to spend it for this. So, but one thing I would like to tell is whatever time you have, spend it on practice. So, that is what I would like to tell. Rather than don't compromise your practice time for reading guidelines. That is what I would like to emphasize here. So whatever time we had, we used to practice. Even if there is no time to read, we didn't mind. We used to practice. Even if in the entire 24 hours we did not touch a single thing from the book, it didn't matter to us. At the end, we are something that we should have practiced that day. That was our goal. So we kept on practicing, and the practice session itself will give us all the knowledge that is required. So I think no, yes, guidelines matters, yes, but practice matters 200 times more than that. So we should keep
Having
practicing. That was
having a small
yes,
group,
sir.
you three, all three practice, right? As a
Yes, sir. Yes.
so having
Whenever whoever is available, we used to practice.
yeah,
Yeah.
having a small team to practice is very important. So I think this is the most important for all those prospective students. No, so I didn't have any practice partner and all, no excuse. So I think we need to
Yes.
practice. Someone has to give us feedback. We have to talk. So far, we have been only writing the part one, part two. So now we have to do the clinical, and clinical is about more of talking, how you are going to talk. So there is an edge for someone who is able to talk fluently. But others, you have to keep practicing according to your strengths. So the more you talk, you will do better. So I think that is the key. So have a small group study partners who will practice, who will give you scenarios, who will be ready to give you feedback. And similarly, you give scenarios to your partner and they practice and give feedback. I think that is very, very crucial. And you all three were blessed to have that.
Yes. Right from the beginning, we used to spend at least 3 hours, minimum of 3 to 4 hours per day for practice alone. But towards the end, in the last month, some 2 to 3 weeks, we spent even more than that for the practice. Whatever time we had, we spent it for practice. Yes.
Very good. So you didn't give for anything for probability. So when you practice all the scenarios, so not much will be in the probability. Dr. Hari,
Yes,
what
sir.
advice you want to give?
Yes, sir. Like whatever she has said is right. Small group, I feel it's very important, sir. And I didn't read much of the notes and all. Like, Reham sheet is there for video, history. I didn't know it had notes for all those. Like whatever my friends told, like whatever we discussed or whatever listened to the class, I just kept those answers for tackling the stations. I don't think much is needed. Only around 2 3 weeks before exams, I knew Reham had books for clinicals. By then I didn't want to go through that and all. Like whatever we had, whatever we have prepared, I felt that was enough. Rather, practicing it on the patient side was very important. Like around the last 2 weeks, I practiced in my ward. That made a huge difference. I felt because I could even then I could not finish off full steps. Even then I missed plantas. Even then I missed to auscultate the abdomen and all. I felt practicing on the patients is very important. And then
Clinical
Yes,
stations.
sir.
Clinical stations, I think you have to see
Yes, sir.
as much as possible. If you see the exact cases, you are good, or at least in the regular patient with even a fever child coming to your OPD. So try to
Yes.
practice in a way.
With the time, sir.
With us, if
With
somebody
the 5 minutes
to time and give the
time.
feedback, it will be very nice.
Yes,
And limiting the information we have is also very important. So we should not be like we should get all the information right. No, like if somebody has practiced and like if you know the answers to the standard questions, like we should not keep on hoarding information. That will save a lot of time, and we can utilize that for practice.
Okay.
I didn't read through full Mark Beatty or full Rebecca communication or full Reham set. All common scenarios, what has been practiced everywhere, I just noted that down and then utilized. Like whenever I practice, I said the same words and repeated the same answers. I didn't even had time to verify the authenticity of the information. Whatever Shadita and Sasireka told, I just believed. That is how it went for me.
Good. And Dr. Sasireka, what?
Yes, sir. So, like all my friends said, the only reason why we started giving this exam together was that this exam needs a study partner. Without that, we can't pass. So, we were lucky, all of us were very lucky that we got like-minded, dedicated partners. So, that is the first and most important thing. So yes, practice, and I feel like theory. Like at the end, we were like this guidelines and all. We didn't read. We don't know if at all it comes. What will we do like that and all? But I think they are only repeating the common things. So we just went through whatever repeats were there in the previous 2-3 years, maybe. So all that thing, we made sure that we knew something about that. If this comes, we know how to handle that situation. We may not be perfect. So I think the common things, we shouldn't make mistakes. And clinicals, it is like God given, whatever happens there, it's not in our hands. So make sure that whatever the history, development, communication, and video, those things should be in our hands. We shouldn't mess things up there. So clinicals, anything can happen on that day. So that is one thing. So more than theory, practice. And then I would also say, on the day of exam, even if you have practiced, your presence of mind matters there. If you lose your cool, whatever we have practiced, it will go off, because the believe me when I say, when you, the waiting time is nothing there. From the moment you come out to the time where you search and go back to the place where, which is your next station, 1 or 1.5 minutes will go. So there you won't have time to analyze and all. So immediately they will call you inside and you will go. So it will be like a train rush in that exam center. So if you lose your calm there and your presence of mind, we are gone. So be cool. Whatever we have did, that's all we can do. There is nothing more we can do. Have that confidence, and I think if that's there, it's okay, sir. Theory is very, very minimal. Don't give much apart from the guidelines. I don't think we have to probe much into theory. Whatever is there in the guidelines is enough.
Yeah.
Yes, sir. Like Sasireka said, I forgot to say this, sir. Going through the recalls was very, very, very helpful, sir. We made sure that for the past at least 4 years, we knew something about everything. For each communication scenario or everything, like what to open, what is the opening statement that we would give, what 2 points we would use at least to run that 9 minutes time. So going through the recalls was very, very useful, sir. Like almost
And
8.
I remember Dr. Hari was in the group. He was asking about that foster carer and tetralogy.
Yes, sir.
Yes, sir. Yes,
It's
sir.
all
Everything from recalls.
recalls. Communication, especially, it was where the recalls were very like wide. They like asked like random things also. So we were like very, what to do? Why is they specifically calling a foster carer here? Is there anything else that they follow in UK? So we were
Same
like,
thing they asked in Mumbai, na? So same scenario. I think that is the thing. So be prepared with all the recalls.
Yes, sir.
Here, actually, I feel that MRCPCH, they are not into giving some tough scenario which you have not seen at all. So it is not their motive. Their motive is see, the patient will keep coming again and again with the same problem. So they have only a handful of scenarios. So whether you are able to manage that scenario properly or not. So they don't want you to give challenging something new. The whole 10 stations are new. So like that, they don't want. They want like when you are in NHS system, the patients keep repeating with the same problems. So group will come again and again. So an angry mother who wants some tests, so she will keep coming again and again. Whether you're able to handle that. So they keep repeating. So that is where the practice is important. So when you keep practicing, the uncertainty will go off and you will be able to do well. I think that, yeah.
So at the last, staying calm and confident. That's also the first most important thing in a clinical is where you could lose your entire mark is by harming the patient. So we should not show our apprehensiveness or our tension on the patient by making them uncomfortable or causing some pain to them. So you should be very careful in that whatever knowledge you have will become zero if at all we are causing any harm to the patient. So just stay calm, cool, and while entering, do not be preoccupied, and while coming out, do not carry the baggage of that previous station. That is what we need. And the rest of the stations, practice is more than sufficient to get through. Guidelines will help. That's all.
And about our practice sessions, how it helped target MRCPCH classes and
Yes, sir. We actually found it only at the last. Like, I just before and all, I joined some other platforms as well. I didn't know like Target was there, or else it would have been even easier for us. I would have appeared in September itself if I have known Target is there. I
oh,
like that was the thing. I really felt regretted about my decision of not knowing it was existing. Like
okay.
it's not a flattery and all. Like, it was a true experience I had. I joined some other platforms based on like what is it's all based on how people market and people how people go into. And
Yeah.
then only I realized Target was there, and it's what was only last 3 months with you. It was very nice. Uh, it was
Yeah.
true mentorship. So you justified the word mentorship. That is in one line, I should say. Like whatever information we had, you just fine tuned everything. You said enough is enough. You were very clear, simple, and to the point. That is what is all needed for the exam. Nowhere you threatened or nowhere you pulled our confidence down. It was all like smoothly fine tuning ourselves. I felt. Only regret I had was if I had it, known it by June by then, I would have done it in the September exam itself.
Earlier.
That
Okay.
was in Chennai.
Thank God
But
he didn't know, sir. Then I wouldn't
that
have
was the only thing. Then
happened.
I joined all these people in September, and we joined you in November, I guess. But Bangalore center was also very good. I was really happy that the center was
Yeah.
Bangalore. It was
Mumbai was a bit difficult actually. So I think next week maybe we will call Mumbai
yeah,
candidates. So they had a tough time actually in Mumbai.
they
And
were very good, sir. Like we hosted the exam so well. It was neatly organized. The role players, the examiners, the patients, everything was so good. If something goes wrong, it is all our fault. That
see,
was the thing.
that is the thing. So one center is like that, and similarly we get tough examiners also. So only way to bail out is be perfect in all the stations because we don't know which station, which clinical will mess up. So at least in the remaining things, we should try to score perfection. Then only we cannot accept. Okay, 1 mark, 2 mark, we can go average because we cannot get average mark in all the stations. One or two station will definitely pull us very badly down. Not because of our performance. It doesn't meet the examiner's expectation or the case is totally. Because MRCPCH doesn't bother whether it is a tough case or easy case. Whether you are able to examine properly and get the findings or not. That's all. If it is tough, you're gone. So they are not bothered about, okay, it was tough, we will give him grace mark, not like that. Yeah.
We all three felt will not clear. We
True.
it happens to everybody. The post-exam anxiety is real.
Yeah, that
For me, it
person.
was I didn't complete examination in many stations, so that was So just to be at least happy after the exams, you should finish up all the examinations, pick up the finding. At least that will just give some sort of satisfaction.
Yeah. Okay, so
Yes.
others now, I think we will keep it open for others to interact. Another 5 minutes closing. Anybody wants to talk to the Dr. Sajita, Dr. Hari, Dr. Sasi?
Hello, I am Dr. Eman.
Yeah, doctor.
First of all, I would like to thank all of you for sharing all the insights. It was really, really helpful because this is like the first time we started preparing, me and some of my friends. So I just wanted to ask, can you guys describe a timeline, any one of you, because all three of you studied together. Like initially, you have mentioned that initially you used to study for so many hours and then later. But can you just describe, like, did you just follow the target the thing, or did you read the books first, or how was the process of doing? Did you do all the video stations first and then communication? Can you
Yeah.
just guide us on that, please?
Yes, I would suggest you to, like, if you've already joined the course, no problem. If you're not yet joined the course, I would suggest you to look into the free videos of all the platforms first. I realize what's happening inside. Like almost all the platforms have 10-20% of the portions as free videos, some insight into all the stations. You just get oriented yourself to all the stations, what's happening inside, how's the timing, what is being expected and all. Then start preparing, start practicing, and then you can join a like once you are about to book your exam, you can join a mock group. That will be the right way, I feel. But from the day of starting the journey, you start practicing with your colleagues, whatever information you have with that, to start practicing all the stations every day. Like if you are a group of 5, you can practice one development, one history, one clinical, one communication, one video, based on the knowledge of what you have from the free videos that are available on the YouTube. Once you are like accustomed into the system, you can join a mock group and get through the exam. Comfortable timing will be around 3 to 6 months. If you are not into your family expansion, if you're not married, 3 months is more than enough. If you are into a family, you have a kid and all, I should say comfortably it should be between 3 and 6 months. I hope I was able to answer.
Yes.
We have to practice. We made sure that we touch all the stations every day. Like one day I would attempt history, the other person would attempt development, the other video. So video first together or history next together. Rather than that, from the first daily, every station if touched would help very much. And I was the last one to join this race, I should say, because even before me, my other colleagues had started preparing at least. I was very hesitant to join the practice. I said, let me orient myself. I will read first and then I will join your practice. But then Dr. Hari kept on pushing me, no, practice is what matters most. So you join whatever you know, you join and practice. So that I felt that I should thank him very much for that. So
No problem.
daily practice, daily touch everything. Don't clump together. So for the first month I will do video, the next month I will do development. But keep rotating everything. Touch frequently all the stations. That will help.
Yeah, at least initially you can practice for the role play for tomorrow's. Maybe if you're a team of 3, you can just prepare for the role play for the next day. You can give one clinical station role play to some other, and then you can attend and read the other things. Initially, it will be like that. Like you'll not be having more than 2-3 hours, but towards the end of the examination, the last 3 months, you can spend around 5 to 6 hours daily. That will be enough, I feel. 3 hours will be with the mentors, and 3-4 hours you can read and practice for yourself.
One important observation regarding timeline, I feel that many know after getting allotted only they start preparing. So there it's a real problem. We hardly get less than 2 months now. Once allotted
Yes.
there, then it becomes stressed also. We would have put all the money and it looks
Yes, sir.
very inadequate time, actually 2 months. So it should be
Yes.
like keep preparing and side by side, you should be ready to apply. And whenever they get allotted, you should step up. So I think the last 2 months will be the step up. Till then, you keep preparing. Sometimes it will be like we don't get allotted also. So that is a problem sometimes. So I have seen few candidates even preparing for 1 year, whole 1 year also. So we should not get vexed about it. Always helps us in the practice, in the real time practice also. So keep preparing. Once you get allotted, I think you step up to that 6 hours mark. Till then, daily keep practicing.
Yes. I wasn't sure if what we were doing was right or was going to help at all. We just kept practicing. We role played for somebody, and once we started attending mock only, we understood that practice really matters and it really made a difference. Only then we understood. So, yes. But I should really I didn't have a chance to thank you all, sir. Each one of you were awesome in your own way. Like Dr. Hari said, you didn't bring down our confidence. That is what is making you all of you great mentors, sir. You always put told about our positives first and then made corrections on us rather than pointing on our negatives alone. So that was actually very great from all of you, sir. Yeah,
Thank
I
you.
wouldn't do it any differently or prefer any platform at all. So, yes.
Yes,
Thank you
yes,
so
sir.
much for
True words,
guiding
actually.
us.
Actually, all of you, sir. It's not like one or two. It's since you're a group of people. I think each one of us, of you, were very unique in your own way, and you
Yes.
helped us all tremendously, sir. We wouldn't say that no, this sir was great, that ma'am is. Each and one of you were so dedicated.
Actually, we in that way also we planned that way, not to imitate others, so that each one will
Mhm.
give a different
Yes,
perspective.
sir. Yes.
We wanted that because in exam also we have different examiners, so that's why we don't try to have some pattern and follow the same pattern, because
Yes,
each
sir.
examiner will be different, so that at least five mentors we give a different perspective, so that will be helpful. So
And also
So,
for the money that we pay, I think I can say with
justice done.
confidence, yes, yeah, it's worth every penny that you pay.
But towards the last one, we felt like you
Felt
were all
like,
spending more time for preparation
yeah,
than
than
us.
us.
Yeah, it's only our time that does, the time, the amount of stress we undergo, and
I think
we
the
balancing the
challenge
family, that is difficult. Yes, sir, sorry.
the challenge which I felt when I was preparing, like giving a scenario to your colleague and you yourself preparing, so both it's kind of difficult. So we prepare, we study, then again we have to prepare a scenario for our colleague, no, so then that becomes difficult. So that way I felt like mentor helps. So he
Yes, yes.
already prepares, his job is to prepare and give the scenarios, so that way you concentrate on reading the stuff
Mhm.
and
And
the
can
feedback. So someone has to tell that this is how it has to be corrected, because many times friends no are not that critical.
No, and we don't know also, sir. We don't know whether what we're
we
doing
don't
is
know, that
right
is the
or
thing.
wrong.
We try to be so critical only, sir, but we don't know things. That's the problem.
Yes.
We were very critical from the point.
Whatever critic, we will not fear Dr. Sajita, no? Like, okay, ma. So I think it was wonderful talking to you. And again, the same nighttime remembrance
Also,
has come.
yeah,
Actually,
actually, I
after
felt so happy to come here today just to meet you
yes,
all. I really felt
yes, sir.
this
After a
10
long
o'clock.
It was
time.
like after the exam, I had some withdrawals. I wanted to learn something, practice something. Had withdrawals. Okay.
Thank you. Thank you.
Actually, missing all you, sir. And,
Thank you, ma.
And
Thank
yeah,
one
yeah,
thing which I
thank you, sir.
should say is, like you start behaving as a team. Like last 2 months, we're all together. It's a team. If something is not answered, you will, like if you pick up something from that RCPCS guidelines and all, if you put, you will also, like if it is new, you'll also make sure the information you provide is
Correct.
like
Accurate,
accurate.
authentic,
You will
yeah.
make sure
This
and
is
you
an
will just some.
assessment, no, in development.
Yes, yes, sir. That is what uh, yeah, that was something very nice,
Yeah.
I should say.
Okay, ma. Thank you, ma. Thank you.
Thank you
Thank
so
you.
much, sir.
Thank you,
Thank you,
sir.
We
sir.
wish
Thank
you
you so
all
much,
the
sir.
best, ma. We wish you Dr. Sajita, Dr. Hari, and
Thank you, sir.
Dr. Hari all
Thank
the
you,
best.
sir, and I wish all the
Thank you,
candidates
sir.
Yeah.
All the best.
The other
And
candidates also, we want you to prepare and move forward. We are always here to support you.
sir,
Thank you. Thank you.
Thank you.
thank
Thank
you.
you, sir.
Thank you so much.
Thank you, sir.